I'm Pratik Ghosh. I work as a practice medical receptionist at the Malden Family Health Center at Tufts Family Medicine Residency. I just came back from IHI's summit on improving patient care in the office practice and community.
Hey, I'm Greg Sawin. I'm the program director.
My name is Sandy CHAgoesto. I am a medical assistant at the Malden Family Medicine Center.
I'm Cheryl Dwyer-Spinelli. I'm the operations manager at Malden Family Medicine Center.
It was just a great experience.
I have to tell you, it was a wonderful experience, and I am honored to have gone.
Blew a lot of our minds.
We stepped outside and he said, Sandy, I met with the CEO of a company.
It was extremely interesting. We were very lucky that we were able to bring a front desk person, a medical assistant, as well as a nurse with us. So honestly, I don't know what was better for me to be there, or for me to watch the three of them and what they got out of everything.
I said, gee, I'm just a medical assistant. You know, what do they want me there for? Like, honestly, this is how I felt. And then just going there, and then, like, you know, the doctors were talking, like they said, the medical assistants play a key role in, you know, the clinic.
First of all, I'm not special. I just happen to have the schedule that allowed me to get pulled away.
First of all, just hush for a minute. Everyone is really special, and I don't mean that in a cliche way. I think that's one of the things we learn is like we really need every single person here to be involved in making this an awesome place.
Great sharing ideas, back and forth.
One of the big things that we're starting to learn more about as we start to do this work is that this is not all about doctors figuring out how to do stuff and then putting orders in and then everybody does them. It doesn't really work that well that way. We have a system that's been trying to do it that way for a long time, and we have a system that is really expensive and doesn't produce very good health results. So really trying to figure out how do we do this together and really start to think about how we're redesigning our whole system to deliver this care.
It's all up to the patient. It's not about me, it's about them. So instead of asking the patient what's the matter with you, just ask them what matters to you, you know?
If you go to a restaurant, okay, and you have the receptionist say to you, you gotta wait, I don't know how much time it's gonna be, and you're standing there, you wait 35 minutes, then you get seated, the waitress doesn't come over for another 20 minutes, you don't even have water or bread, you're ready to eat someone's face off. And are you going back there? You're not going back there. You'll never go back there again, and you'll tell every friend you possibly know, don't go there, it's awful. I know we do them already here. I think we can do them. I think we can do more of them, and I think we can do it better.
Please hang up and try again.
They start from the oldest patient to the youngest patient. So, which is interesting about that is, once you start with the oldest patient, they go through all their problems, whatever they're going through. By the time they get to the youngest patient, they're gonna be like, oh, I mean, this is what you're going through. I gotta make sure I'm gonna be more healthy. I'm gonna, you know, exercise. I'm gonna lose weight. I'm gonna do this and that.
You just bounce stuff off the patients. Let them answer the questions.
They're teaching each other what the problem is, rather than like the doctor saying, okay, let's take you separately, me separately.
If they're seeing a diabetic that's been a diabetic for years that is having a difficult time, and they're pre-diabetic, you bet your sweet bippy that they're going to fill the medication. They're going to want to reduce their weight.
There was so many people there, I was like, wow, this is big.
Most of the classes that we went to had things in it that we're doing already.
A lot of the quality improvement stuff talks about healthcare as if it's this product, like a widget or like a car. And
wow, this is pretty big to me, I said.
Pack that. Like every touch with the patient is actually a really treasured encounter, and we need to try to put as much value into that as possible to how do we understand how to do that.
our product is not, you know, a procedure per se, or a central line, or you know, an intubation. Our product is really our relationship. Messy, long-term, complicated relationships, and relationships are what change health. We're not their bosses. We're more like their financial advisors. I mean, like, or their servants, really. And we can't just keep telling them what to do and expecting them to change. Population health, experience of care, and per capita cost. So being much more transparent about what our goals are, trying to affect change at the federal level was like trying to sew a quilt with a huge quilt with a tiny, tiny needle wearing 3 pairs of mittens. And so the point was that where change happens is here. It happens at the community level. It happens among us. And so it's really up to us.
Our job is about this relationship. So instead of kind of like, I feel like right now sometimes we have our jobs defined and it's like hot potato because we're so busy, everybody's so busy in every job that they're doing. So like at front desk, what do we measure? We measure phone abandonment rate. So their biggest thing is like, get on the phone, get off the phone, get on the phone, get off the phone. Every touch though, ideally we want to make as rich as possible.
We can become the NUCA of family medicine, residency education, and clinical care. And like, how amazing would that be?